Welcome back. Vice President J.D. Vance signaling that the government will likely shut down tonight, just after midnight, as Democrats will not support the Republicans' continuing resolution without adding $1 trillion in health care spending. According to Republicans, the Senate will vote today on the House-passed bill, which keeps government funded into November. But the Senate is rejecting plans from both Republicans and Democrats earlier this month. Joining me now is California Congressman Khanna, a member of the House Oversight, Armed Services, and China Select Committees. Congressman, it's great to see you this morning. Thanks so much for being here.
Good morning, Maria. Always a pleasure to be on.
Are you expecting a government shutdown? How do you think this plays out?
I hope not. Here's how we see it from the Democratic side. First, we want a commitment that whatever Congress passes, the president will spend. I mean, the reality is that the president has not been willing to commit to actually spending what Congress appropriates. And in some cases, he's had this theory of impoundment or rescission, that he can just do whatever he wants. So what's the point of having a negotiation if he's not going to commit to actually living by what we authorize? And the second, as you pointed out, is to get the Democratic votes, we need to make sure that either there's a reversal of the Medicaid cuts or there's not going to be a tax hike on millions of Americans who are on the ACA, whose health care is going to go up almost 80%. Final point is the Republicans have the votes. They can pass it through the Senate, the House, the presidency. They have the power. They can get rid of the filibuster and do this tomorrow.
Yeah, but you don't want them to get rid of the filibuster. Nobody wants to get rid of the filibuster. They want the 60 votes and to have regular order. Look, Republicans have been on this program this morning, Congressman, and what they keep saying is that the Democrats want to make it easier for illegal immigrants to get health care. And while they say they want to return to pre-COVID spending, there is no effort on the Democrat side to return to pre-COVID spending if you're adding $1 trillion in health care spending. Your response?
First of all, the filibuster, I've been consistent. I called for eliminating the filibuster when Joe Biden was president. I think they should do it now. They already have eliminated it for so many things, like the presidential appointment. So if they want to pass a budget, they're in power. They have the Senate, they have the House, they have the presidency. They can do it tomorrow. In terms of health care, the reality is they're just not being honest. The amount of money that actually is going towards people who are undocumented is such a small portion of the Medicaid cuts or the Affordable Care Act, if at all. And so we can argue that point, but the reality that even the vice president would acknowledge, that anyone who looks at the numbers will acknowledge, is 90 to 95% of the funding we're talking about is talking about funding for American citizens. And what they're doing is they cut already Medicaid funding. It's going to hurt, as Josh Hawley has said, rural hospitals. It's going to hurt people who are 90 million Americans below $75,000. And now they're talking about anyone who's on the exchanges having a tax on them of 80% increase on their health care premiums.
Now, do you worry that this is coming across to the public as, look, anything President Trump wants, the Democrats want to fight? Because earlier in the show, virtually every GOPer I had on the show said the same thing, that it's really less about health care and more about whatever President Trump says, we have to fight. Chuck Schumer is afraid that he's getting primaried by AOC and that he's afraid to go against the Democrats, and that's why he's digging in. So what do you say about the idea that this is not even about business as usual? It's more about showing that the Democrats are tough, that they're against Trump?
Well, look, when Trump does things that I agree with, I'm one of the first people to support him. I introduced his executive order to lower prescription drug costs as a bill. I said that, we should make sure that Americans are being charged the same as people in other countries. I was just in China, and I actually praised Secretary Bessent's negotiation on fentanyl. I said, absolutely, you need to classify the precursors that are causing fentanyl in the United States. You need to classify them. And in a bipartisan delegation, we're behind Secretary Bessent in getting that concession. So there are areas where there is common ground. But the two things that the president needs to acknowledge is that Congress has a role. He can't just determine whatever he wants to spend. I mean, it's if he doesn't like foreign aid spending, fine, but come to Congress. You can't just say unilaterally we're not going to spend things. And the second is on health care. People are hurting. Working class families are hurting. Democrats, I can't give my vote to cut health care funding. And if they want to do it without my vote, they have the votes to do it.
Yeah, and I'm glad you mentioned the prescription drug pricing, because I also have been praising you for months about what you said about prescription drug prices. Everybody feels that everything is way too expensive, so it was really heartening to see you say, you know what, Trump is right on this, I'm going to get behind it. But you're not reflective of the Democrat Party, nor is John Fetterman. You have governed with moderate governance. You have governed with common sense, just as John Fetterman has. I had the Pennsylvania senator on Sunday. Here's what he said about this shutdown. Watch this.
It is always, always wrong to shut our government down. That is a core responsibility. I'm always going to vote against those things. And if it's the Republican side or now it's our side, especially with the kinds of chaos that we are facing after Kirk, and now there's a Cat 5 storm that might hit our nation too. Now, and you're willing to threaten us down. I was the only Democrat voting against that. And now that CR was the same CR from the Biden administration as well too.
Right.
For me, I'm a big believer of if you want to change the policies, win elections. And that's really the way democracy works.
So, Congressman, that's my point. Do you worry that the Democrat Party is going way too close to the edge in terms of socialism? Look at the mayoral race in New York. Look at AOC and Bernie Sanders, the way they talk. It's very different than what you hear from you, from what you hear from John Fetterman. And what about the White House's warning of government layoffs should the government shut down? How significant will those layoffs be? Will they be permanent?
Well, there's a common thread among all of the people you mentioned, between Mamdani to AOC to John Fetterman to me, and that is that we think that income inequality is one of the biggest issues in the country. That my district, 5 companies over $1 trillion, $14 trillion of wealth, and 70% of Americans feel that the American dream is dead, and that we have a vision of how we're going to bring new industry, create new jobs, lower costs for Americans. And some of frankly, the blanket trade policies haven't been working. One of them, I have a repeal the coffee tariff. I mean, coffee has gone up 26%. We don't even grow coffee in the United States, other than 1% in Hawaii. But look, I want to find a way to keep the government open. I think if the president at the very least came out and said, look, I'm going to respect Congress and I'm going to make sure anything in that budget we're going to actually spend, and I'm not going to tell my executive branch to just withhold the funding, that would be a constructive step. And then my hope is that he'll realize on health care, why does he want health care costs going up 80% on the exchange under his watch? Senator Schumer suggested that he was actually open to it in the meeting. Then he put out the silly video that I found quite offensive. But fine, let's move on. Let's put out a proposal on health care so health care premiums don't go up.
Congressman, let me move on to your trip. You just mentioned the CODEL, the congressional delegation that you took to China. How was the trip, and how do you want to approach governing and our number one adversary as China continues to undermine the United States? Here we have a situation today in Philadelphia, where the Philadelphia Office of Immigrant Affairs is expected to raise the Chinese flag in front of City Hall to celebrate the establishment of the Chinese Communist Party. Now, this event is sponsored by the Pennsylvania United Chinese Coalition, Congressman. I find it really striking that they're going to raise the Chinese flag in Philadelphia, the birthplace of the Declaration of Independence. Your reaction?
Well, it's, of course, most importantly the birthplace of the independence, but it also happens to be my birthplace. I was born in Philadelphia in 1976. I'm a bicentenary baby, and I don't get it. I don't agree with it. I mean, the only flag that should be going up there is the American flag. And the Communist Party, as you know, did so much harm. I mean, the Great Leap Forward led to famine. The Cultural Revolution led to huge violations of human rights. We had a bipartisan delegation there led by Ranking Member Adam Smith on the Armed Services Committee, and the biggest thing we pushed was the fentanyl categorization. We said this is bipartisan. By the way, our ambassador there, Ambassador Perdue, is doing an excellent job, and I have a call in to Secretary Besson to brief him on what we did. They are willing, in my view, to do a deal on fentanyl and classifying all the precursors in exchange for some relief on the tariffs. That would be progress. And there again, I would support the president and credit the administration if they get that done.
Yeah. Congressman, thank you for taking that trip to China. That was huge. And thanks for being here this morning, sir. Good to see you.
Thank you, Maria. Always a pleasure.
Congressman Khanna joining us. We'll be right back.